Hello, everyone. My name is Jaysson Brooks from the Scottish Rite Hospital for Children in Dallas, Texas. I'm a pediatric orthopedic surgeon, and I am very happy to be hosting this newest episode of Scoliosis Dialogues for the Scoliosis Research Society. We have two really exciting guests we're going to be speaking to today. And really, we're going to be focusing on the upcoming annual meeting, which I know we're all excited to go to in Barcelona. So I'd like to introduce Dr. Brian Hsu and Dr. Javier Pizones. Welcome, guys.
Thank you for joining us, Jaysson.
So, the Scoliosis Research Society is such a dynamic and diverse society. And so while you all are very big names in our society, not everyone may know you all. And so we kind of wanted to get into a little bit of who you all are first. And so, Brian, let's kind of start with you. Tell us a little bit about where you practice and how you started getting involved with the SRS initially.
Sure, thanks, Jaysson. My name's Brian Hsu. I'm an adult and pediatric orthopedic surgeon practicing only in spine surgery, and I practice in Sydney, Australia. I've been practicing since 2008, since I finished my fellowship at UCSF and Twin Cities. And I really got involved in the SRS because when I finished my fellowship at Twin Cities, Bob Winter said you had to join. So we basically joined SRS, and that was it. There was no discussion. Everyone had to join the SRS. So I've been coming to meetings at SRS, and I find that very, very useful and very important to keeping up to date with in my practice when both adult and pediatric spines.
Excellent. And so, Brian, just as the follow-up, so I know in the UK, a lot of the pediatric orthopedic surgeons don't do spine, and so is that the case normally in Australia, or did you have to do 2 fellowships in order to be able to do spine in Australia?
No, so I don't do any pediatric orthopedics in Sydney. So I'm purely a spine surgeon. Okay. In my orthopedic training, we had to do pediatric orthopedics as part of our training to be an orthopedic surgeon. But since I finished since I achieved my credentials as an orthopedic surgeon, I'm only practice as a spine surgeon in adults and pediatrics. So my practice doesn't include hips, knees, or any of that, but just pediatric spines. But to your question, yes, we do tend to have subspecialized pediatric orthopedics. We actually have a team at our children's hospital where a team is focused on hips, a team that's focused on maybe knees and ankles, foot and ankle, and different types of upper limb surgery and things, and hands and different subspecialties.
Excellent. Okay, Javier, you are not a new face to the SRS podcast team, but for those who don't know you, give us a little bit of a update on where you practice, what your practice is like, and how you first got involved with SRS.
Oh, for sure. I was born and raised in Madrid, Spain. This is in Europe. I think everybody knows that already. I was trained in the university in Madrid, and then I did my orthopedic surgery residency also in Madrid. We don't have a fellowship program in Spain like you do in the US and other parts of the world. So when you finish your residency, you just start working on what you most like, and that was spine surgery for me. And since then, this was 2005, so it's almost 19 years already. I focused only on spine deformity. I do also DGen, but mainly spine deformity, adults, and also pediatrics. Okay. I work in a big hospital in Madrid. We have 5 or 6 different big hospitals in Madrid, and this one is very complete.
Yep. Not to interrupt you, but I'm curious, for those of us who don't understand kind of the geography of Spain, will you be able to just drive over for this meeting, or is it much further than we think, and you might have to take a flight over to Barcelona?
We can do both. Madrid is the capital of Spain. It's just in the middle of Spain. You would see that Barcelona is in the upper corner to the right, close to the French border. It takes 6 hours by car, an hour by plane, for 50 minutes.
Okay.
Yeah.
Excellent. So we are here today because you all were both integral in kind of setting up the program that we are going to be experiencing and enjoying when we're in Barcelona. So for those who are thinking of getting involved in SRS committee, just kind of give them an understanding of what an undertaking this is and how you put together a program that gets people excited to come.
If I can jump here first, Jaysson. Beforehand, I want people to know that before you get to a chair position, you have to go through different committees in the SRS. So you really have to involve yourself with the society, and then you bring up yourself, and then you escalate until you get to one of these positions. So I've been already part in 7 or 8 different committees before I came to the educational committee. But once you're in, and Brian can tell you too, things are really easy because there's a big group that helps you out with the task. So it's a big task too, but you have a lot of people helping you.
And I guess that sort of comes, brings up a good point, because as you join different committees, you get to know different people, and you also get to know how things are run, and you also get a feel of how education is sort of organized and how ideas come about. So there's actually an enormous amount of what you could say corporate knowledge within the organizers in SRS. So even with our meeting that Javier and myself are chair, we have relied on a lot of the past chair's experience of what happened last year, what worked, what didn't work, what we should change, and you pass on a lot of that knowledge to the next chair and help and they're part of the committee, and they help sort of guide the program for the next people in charge. So it's actually really done by the whole community. And the point that Javier is making is that when you sign up to become part of the different committees, you meet other people, you learn how to work with other people, and then you gather that sort of knowledge to come to this point.
That's excellent. So it's great they don't just throw you into the fire and expect you to go. That's excellent. So for those of you all who are not actually looking at the program, I'm just going to give everyone just kind of quick, broad overview of what the program is going to look like. So if you're fortunate enough to be on the SRS Board of Directors, you will be flying in earliest because your meeting is on Monday. Tuesday is when a lot of the committees as well as councils actually meet. And so a lot of you all who are on various SRS committees will be flying in early in order to go to those meetings on Tuesday. But they will also be having the HIB Society meeting. The HIP Society usually has various topics. Are you all involved in planning out the program for HIBs, or is that a separate committee?
We actually are in charge of what happens at the end, but the traveling fellows of that year, the ones that put in the complete program and agenda for the HIBs. Okay.
Excellent. And then, so really, it sounds like a lot of what you all do really starts on Wednesday with the pre-meeting course. And so the pre-meeting course, I'm very interested in the topics because it really kind of, as a pediatric orthopedic surgeon, we operate on a lot of kids, but sometimes we don't know what happens to them 25 years later. And so it seems like that's the overall theme. Like, what is the long-term outcomes of all the surgeries that we do on both kids and adults? But if y'all could just give our listeners a bit of an insight into what the pre-meeting course is going to look like on Wednesday.
Yeah, the pre-meeting course is going to be 3 hours on Wednesday, and as you say, it's going to cover long-term outcomes of what is happening with the kids, adolescents, and adults, because we have 3 different sessions. What happens in the long run? So we were really interested in to see what are the results 20 or 25 years after surgery. So the first session will go with taking talk with the EOS patients. So what happens with pulmonary function in graduates, what happens with long-term mental health, for example, or hazards in the treatment of these patients. And then we'll have some talks comparing traditional growing rods with MAGIC, and then an update on what happens with graduate patients on the long run. The second session will be on AIS, almost the same idea, is what is the natural history of non-operated patients and what happens with those that we have operated 30 years ago, and what is the long-term results of the DGen, the lumbar mobile disc that we have free in terms of MRI and degeneration. And then we are going to touch also on pregnancy, childbearing, and psychological function of these patients. And then at the end, we'll have a last session on adult deformity, same thing. We don't have 25 years experience on this, but we already have 15, 20 years of, well, what are the long-term results of these patients, how we can improve the performance and outcomes, how is MIS changing the game, and what is happening with health economics. We are focusing on that. This is a 3-hour, very compact and very powerful. We have a lot of faculty from the US and outside the US, and I think it's going to be really, really interesting.
That's awesome. And so also on that day, we're going to also have the lunchtime symposium, which I know you all are involved with also. So Brian or Javier, I don't know if y'all could give our listeners a little bit of what they should expect besides the good food, but from an educational standpoint during the lunchtime symposium.
Yes, the lunchtime symposium is the ideas are submitted by the general membership, and this year we have quite a number of proposals, and some of them were all of them were very, very good, but we actually had to really choose and really decide on which ones to actually put on the lunchtime symposium. So we have Michelle Welborn chairing a session on hypo to hypokyphosis and managing the sagittal plane in pediatric spines, and that's going to be very, very interesting, because that's something that we will all find challenging in managing the pediatric population. And then we also have a session chaired by Erin Kouros on surgeon longevity in spine surgery, helping our patients while protecting ourselves. And this is a very good topic. I think it first started with Sukin Shah's annual meeting a few years ago. I think it was Bologna when we first started talking about how to prolong our surgical lives and how to keep ourselves fresh and prevent burnout and things like that. So that's going to be a very interesting topic as well. And then the third lunchtime was,
that was the first SRS meeting I went to as an attending, and I remember sitting in the meeting, hearing all of the senior surgeons talk about all of the joints they had replaced, all the things that were hurting on them, and I sat there, in my first year of practice, thinking, I've got to do something different, because I want to make sure that my body is not broken down by the end of this. So that was really formative for me to hear that so early on in my practice. And I think it kind of led to me really quickly adopting to try to transition a lot to things that involve power, to try to just decrease the wear and tear on my joints and think about ergonomics and what I was standing on, what sort of shoes I was wearing. And so that was a really a powerful session that they had there. And it's really great that they're continuing with this now.
That's right. And also, we don't tend to talk about, your mental health as well. How to deal with, being sued or complications and, things like that you also, we're not good at talking about that. And that's very good that we bring that up so we can actually share those experiences as well. And then the other lunchtime symposium is chaired by Mark Wienerbaum, a step towards improving preoperative optimization for deformity surgery, which is also a very much a hot topic in adult scoliosis.
That's excellent. So it sounds like there's going to be very, very interesting topics during the lunchtime symposium. Of course, there'll be lots of other abstracts that are going to be presented on that Wednesday. But for our listeners, we always have a non-medicine related lecture on Wednesday, the Howard Steele lecture. And this year, the speaker is going to be Bruno Dubois, who actually was a high performance, he actually managed high performance sailing teams, particularly yacht racing. I think he's going to be just really dynamic, as he's a former sailmaker and has over 250,000 miles of sailing underneath his belt. And we'll really talk about what it's like to lead a team. And I know for a lot of us in our work lives, sometimes in our home lives, we are leading teams. And it's important to hear his pearls of wisdom when it comes to best practices for leading these teams. And so that's going to be a really interesting speaker for the Howard Steele lecture on Wednesday.
We can actually put in a little spiel next about the sailing, because the America's Cup is in Barcelona at that time. And that's also one of the reasons we want everyone to book their hotels early, because it's going to be hotel rooms are going to be at a premium.
So yes, Bruno Dubois is going to be an excellent speaker for the Howard Steele lecture. Interestingly, with his history of sailing, at the exact same time as the SRS meeting, the America's Cup is going to be happening in Barcelona, which is one of the largest sailing competitions in the world. And so for those of you all who have not booked your hotels, you've got to do it, because all the hotels are going to be completely taken up, because we're having such a huge event happening at the same time as SRS. So kind of along those lines, what should the listeners be looking forward to when it comes to Barcelona as a city? What fun things are there to do when they're not gaining all this excellent spine education? What can they do to have fun kind of in the evenings?
Have you ever been to Barcelona before, Jaysson or Brian?
Well, I've been to Barcelona before, and I was going to say that, before I let Javier sell his own country, I certainly very much enjoyed the last time I was in Barcelona. The food is magnificent, the architecture is magnificent. Hopefully we get the weather around that time. September will be magnificent as well. But there is just so much history and so much to see in Barcelona, besides the obviously magnificent SRS annual meeting program.
Yeah, you can find Roman ruins in Barcelona. So we're starting from there, 2,000 years ago. The city center is really, really nice, packed always with Japanese and Chinese guys that are coming as tourists. It's a very nice city because there's sea, so the sea is the Mediterranean Sea. And in an hour by car, you have the mountains where in the wintertime you can ski. Wow. Very multicultural city, interesting for sightseeing, very good weather in September. So I think we can all enjoy, and the food for sure.
Excellent. Excellent. Well, there you have it, everyone. Our upcoming annual meeting in Barcelona is going to be a excellent program with lots of education. For those of y'all who have not registered yet, you got to do it. This is going to be a can't miss meeting. And I really want to thank Dr. Pizones and Dr. Hsu for taking the time to, first off, really plan the program for this meeting. I know it's been a lot of work, and we're looking forward to actually experiencing it in person.
Thank you very much, Jaysson, for having us here with you.
Thank you, Jaysson, and I hope everyone comes to Barcelona for the annual meeting, and look forward to seeing you there.
Awesome. Well, y'all have a wonderful day, evening, whatever time it is in Australia and Madrid, and we'll be seeing you soon.